Your diet does affect you mentally, physically. If you have poor eating habits, you are much more likely to get sick. You're much more likely to have an acute or chronic disease. If you have chronic illnesses, you're much more likely to get worse, or what we call exacerbations. You know, you might be diabetic, but exacerbation would be if all of a sudden your blood sugar drops or spikes because there's something wrong, okay? If you do not eat well, you have problems healing. That's why we see a lot of elderly folks getting pressure ulcers, whereas you and I maybe would not, because they don't eat as much, they don't eat as good as you and I would, they're not as healthy, and it makes them overall less healthy. So poor nutrition is one of the big factors of pressure ulcers and wounds not healing and things like that. So as far as physically and mentally, they're going to be much more at risk for injuries, things like that, okay? So another thing is socially, eating and drinking is something we do, makes us happy, right? That's what Thanksgiving is all about. It's supposed to be about being thankful about things, but what do we mainly focus on? The food. You know, food has always been a social gathering for us in our culture, and so that's why we highly encourage the residents to go to the dining room and sit with other people to make eating a social event, because they will eat more in a social setting than they will in their rooms, okay? Now, the things that affect people's dietary practices are going to be things like their culture. There also are certain cultures who will refrain from eating certain types of foods. You know, if you're Jewish, you're not going to be eating pork and certain types of fish, things like that. You know, you're going to have certain dietary restrictions. Finance-wise, I saw it all the time in home health. People spent so much money on medicine, they couldn't hardly afford food, and they really didn't, and they would find it hard to even qualify for food stamps. Or if they did, it would be like $40 a month, or some kind of just crazy low number. And they would, I mean, they ate horribly because they didn't have the money to feed themselves good food. Again, it's also personal choice. You know, everybody has different likes and dislikes as to what you like to eat. Now, the dietary practices also include selecting the food, preparing the food, serving the food, and that's what your dietary in what it looks like, how you prepare it, how you serve it, again, is an individual thing. I'm not going to cook like you cook. Not exactly, okay? My husband and I argue all the time about cornbread because I like it sweet, and he does not, because he came from Lyon County where they don't know how to cook cornbread, and it's not sweet. Or at least that's what I tell him. So I have to cook 2 pans of cornbread every time we have cornbread. So the CMS, which is the Centers for Medicare and Medicaid Services, they do require that the health team as a whole, and who's the health team going to consist of?
The doctors and the nurses.
Doctors, nurses, nurse aides, obviously dietary, especially in this situation, right? Even activities, I mean, you have someone from every department there, even like environmental services, you know, maintenance. Everybody goes to these meetings because we do have to look at the residents' nutritional status because it's so important. So basic nutrition, when we talk about nutrition, that is the processes involved in the ingestion, getting into your body, digestion as it goes through the body, absorption, absorbing all the minerals and vitamins and stuff out of the food, and the use of foods and fluids by the body, okay? So when I say nutrition, that's the whole definition of nutrition. Now, again, we do need good nutrition for growth, healing, which is a big deal, and body functions. You gotta eat good foods to poop, right? All your body functions rely on specific minerals, specific things out of your diet, okay? Now, if you do have a well-balanced diet and a correct calorie intake, you will be healthier. So again, everything that you eat or drink has nutrients in it for your body. Things like the different groups that they categorize them in. You have fats, proteins, carbohydrates, vitamins, minerals, and water. Okay, those are all kind of the subgroups of nutrients. Now, there are dietary guidelines that comes from the Dietary Guidelines for Americans 2010 is where they get this information, and that's for anybody who is 2 years of age and older. Now, they describe a healthy diet as one that's high in fruits and vegetables, whole grains, fat-free or low-fat milk and milk products, okay? They like to have the leaner meats, poultry, fish, beans, eggs, nuts, things like that. And they like it to be low in fat, cholesterol, salt, and sugar, okay? So that's basically not what any of us eats on a regular basis, right? But the guidelines also recommend, have recommendations for people who are at risk for chronic diseases. And the guidelines promote an overall health, and they do that through the diet. Okay, so again, they want us to consume overall fewer calories and make informed, educated food choices, and also be physically active. Okay, because you really can't do one without the other. They kind of all need to be combined. So the My Plate things, you guys have that in school. You guys have probably learned about the My Plate. Okay, and My Plate basically includes these steps to a healthier you, and those steps include like the kind of food, the amount of food you eat every day. They look for gradual improvement, physical activity, which I think our schools are lacking. Okay, they've changed the food in our schools, but they have not increased physical activity whatsoever, and I think that's why you don't see a huge weight loss among students, because they're not including any more physical activity. Variety, moderation. Moderation is a key word in all things, okay? Just like this donut I'm fixing to eat. I'm gonna eat one, and I haven't eaten a donut in weeks, okay? So I'm not gonna starve myself to where I don't eat anything ever, and because that's something I can't, that's not a lifestyle I can keep up, but I am eating in moderation, okay? Now, the different food groups include grains, vegetables, fruits, dairy, proteins, and oils, okay? That's what they're gonna break down those food groups into, okay? Now, essential nutrients. Now, nutrients, when you eat something, there's nothing you can really eat that has every single nutrient in it that you need. I mean, I know you can take vitamins and stuff like that, but vitamins can't replace food. Okay? You absorb and ingest and absorb and get the vitamins the best out of food. So vitamins are good and have their place. Or actually, I've been reading studies where they argue that vitamins don't do any good. I don't know. They don't even know if they think vitamins do any good. But we do know the best way to get the nutrients you need is from actual food. So since you can't eat just one food and get everything you need, then you have to have a variety of foods, because those essential nutrients are very important and must be ingested into your body, okay? So protein outside of water is the #1 most important thing that you can eat, okay? Protein is responsible for a lot of things we'll probably talk about. So you can live without eating longer than you can live without water. So we know that water is #1 on the list. But then we're going to have protein second. Then we have carbohydrates, because carbohydrates provide quick energy. And it also provides fiber so that you can have, regular bowel movements. Then you have fats. Fats provide energy more long term, okay? Your carbs are quick energy. They get you, a lot of people eat them before sports. They play sports because they want that energy real quick during the game, but then they fizzle out afterwards. Okay, fats are more of your long-term energy. They also add flavor to food and help the body use certain vitamins. So fats are important in your diet. You can't cut them out completely. Now vitamins are also needed because even though the vitamins don't actually provide you with calories, your body does store things like vitamin A, vitamin D, vitamin E, vitamin K, things like that. And then you have vitamin C and then the B complex vitamins, which are not stored. So we have part of them that are stored in your body and part of them that are not. Now minerals are used for so many different processes. Okay, you've got bone and tooth formation, which hopefully we don't necessarily, your bones are constantly breaking down and reforming. Even though we're, more than likely, you guys are as tall as you're going to get. But at the same time, your body is constantly breaking bone down and reforming it back. Okay? Now you need bone and tooth formation, nerve and muscle function, fluid balance, and other body processes. Okay? So they're very important. Water is needed for all body processes. That's why it's so important. Now, food labels are something they keep putting more and more regulations on that, but it's something that we use to try to be educated and informed of what is in what we're eating so we can eat a little bit healthier. Now, the food labels contain information about how much a serving size is, the number of servings in the package, and the calories, as well as calories from fat and whatever nutrients are in that. So they even now, like we've always had the ones on the back, but now I like it because there's some on the front too. It's one little strip across the bottom of the front of a package. It'll say how many calories is bigger or in one serving of that food. And it makes it easier to see. Now, factors that affect eating and nutrition include meeting their needs using a health team approach, whatever culture affects their dietary practices, selecting, preparing, and eating food is also sometimes part of a religious practice. Okay, Mills Health and Rehab, where we go, they are actually they're a nonprofit place that is run by the Adventist healthcare system. So have you guys ever heard of the Seventh-day Adventist? Okay, that is a religion, that is a church. Seventh-day Adventists follow the dietary practices of the Old Testament. So they do not eat pork. They do not eat certain fish and different things. So actually when the residents go there, they have to sign this consent saying that we understand that we're not going to get served pork. That doesn't mean their family can't bring it in and give it to them, but as far as out of the kitchen there, they do not serve pork. They serve things like turkey bacon or turkey sausage, things like that. So, so it is part of a religious practice. Finances, again, we talked about affect what people can afford to buy, and then your appetite. And there's a lot of things that can affect your appetite. Some of the medications they take sometimes affect their appetite and make them not hungry. Now, other factors, again, personal choice, body reactions. I might love to eat spicy food, but I may pay for it later, so that's going to affect what I eat. That burrito sounds good until you're in the toilet. You know what I'm saying. So anyway, if you're sick, that affects what you eat. You don't feel like eating as much, and maybe you want certain foods. Chewing and swallowing. Disability, age. Because as you age, your GI tract slows down, and you tend to be more constipated. And if you are kind of constipated, you're not going to be able to eat as much because you feel fuller from just having everything kind of stopped up in there. Now, over in CMS, dietary requirements. Again, we have to make sure we are meeting each resident's nutritional needs. We have to make sure that it's a well-balanced meal that is very appetizing for the resident. Make sure if it's supposed to be hot, serve it hot. it's supposed to be cold, serve it cold. You know, whatever we can do, you know, get it to them as quick as possible, and try to really meet each person's need so that they're more likely to eat more. Now, other foods of a similar nutrition value are offered if they don't want what's on the main course, and you will see that a lot. You know, sometimes they want the beef liver, but they get there and they can't hardly chew it. So then there's always going to be a backup plan. There's always going to be backup sides, backup main dish that dietary will have back there in case the residents don't like what's on their plate. Now, each person again gets at least three meals a day and a bedtime snack, which you guys have seen because of trying to meet nutritional needs for the residents who don't eat very much. They offer snacks in between meals as well. And also the center provides needed adaptive equipment and utensils, okay? For people who have problems maybe with their grip, they have special spoons that are way bigger. The handles are way, way bigger, but they can grab it and they can eat themselves. Because we want them to, but they may not can hold a regular spoon or fork. We have other people that have like Parkinson's and they shake. Well, they have special spoons that have like weights on them, because it's heavier, it slows down the trembling to where they don't hardly tremor, and they can still eat. Okay, or maybe they don't have good range of motion. They have different spoons that are shaped differently, and I mean, there's really a lot of things you guys will notice that they do to try and meet their residents' needs when they're eating. Now, sometimes the diets do have to order a special diet depending on either the patient has some sort of deficit, you know, or maybe they just have a certain disease that requires a different diet. So what kind of diseases would require a different diet? Diabetes, that's a biggie. Sometimes we have, if we have high cholesterol, maybe they need a low cholesterol diet. Okay, I mean there are certain things that are going to require alterations. Now sometimes they need it for weight control. Unfortunately, when you get 90, you're not up running marathons anymore. So because you have such a decreased activity, you are a prime target to gain weight. So because of that, sometimes they do actually put them on restrictive diets. And then sometimes they have to eliminate certain substances in the diet, okay? So regular diet, which is what you're going to hear most often or see most often on the little papers with their meals. Regular diet means there is no restriction, okay? You could see a general diet, house diet, but most of the time you'll see the words regular diet. Now, sodium controlled diet, I see this all the time for people that have high blood pressure. Now, because of sodium, sometimes your body is going to hold in more fluid. And so if we decrease the amount of sodium, then we can decrease the amount of fluid. We see a lot of residents have a lot of swelling in their legs and different things and different reasons that the doctor may want to limit how much sodium they get. So these are the people who are going to complain the most about their food because they can't put salt on their food. Salt has sodium in it, right? It's sodium chloride. So we don't let them add salt. And most likely we're not cooking their food with much salt. So flavor-wise, a little bland. And since they already have poor taste buds, they're really going to complain about their food, and sometimes there's nothing we can do about it. So again, we just try to omit any high sodium foods. What I do in home health was tell them about hidden sodium. Okay?
Mrs. Knoll, please call the office, Mrs. Knoll.
When you get canned vegetables, it has sodium in it. So what I try to teach my patients is when you empty out the can and drain it, and then pour water in it and start like rinsing off the vegetables. And that'll help rinse out some of that sodium so it's not so high in sodium for people. But because we are more health conscientious you do see a lot of low sodium varieties of foods these days. Now, diabetes, again, a lot of times they're taking medications or insulin or different things to try and help, but also we have to make sure that we get them the correct diet that tastes as good as it can, has the most choices that we can give them, but yet we still have to watch their calorie intake, and we have to make sure they're eating constantly throughout the day to make sure their blood sugar doesn't drop or anything. So whenever it's time for them to eat, we have to make sure we serve theirs right on time, get it to them quick so that we don't have such a big time span between when they've eaten to allow that blood sugar to drop. And also we're going to have to tell the nurse what they did or didn't eat. You know, you guys will make a log of how much of their plate they ate, and you'll log that onto the computer. Then we have dysphagia diet. Now dysphagia basically means they can't swallow well. There's something wrong. So a lot of times we have to thicken up some of their foods so it doesn't get into their lungs. We worry about aspiration. So the doctor's always going to be involved. Hopefully we'll have a speech therapist involved with that, occupational therapist, nurse. You know, it's good. It's a health team approach. So when you feed somebody that has dysphagia, first of all, you need to know what the signs and symptoms are if they start choking on something or if they are getting food or drinks into their lungs. So again, you're going to have to make sure that you know what's on their care plan, look on their dietary card and see what they're supposed to have. And again, you follow aspiration precautions, okay? You have to understand that you may, you know, need to be more aware of them choking, okay? Again, you're going to report any changes because sometimes people can get worse. You're going to report any changes. And again, we're looking for things like choking, coughing a lot while they're eating, difficulty breathing, either during or after the meal, any kind of abnormal breathing or respiratory sounds if they start wheezing, things like that. And as nurses, what we do to check for aspiration is we wait an hour after they've eaten, then we take their temperature. And if they've aspirated something in their lungs, their temperature will go about 1 degree higher. Because of course, food doesn't belong in the lungs, your body tries to attack it and treats it like an infection. And your body temperature rises to try to kill the foreign object, okay? So that's what we do as nurses, but that was free. Fluid balance. Again, since water is required for all body functions, we have to make sure that our residents have a good fluid balance, okay? So obviously, either drinking too much or too little water can kill you, okay? Now, we worry mostly, as far as drinking too much, we have certain residents who have kidney problems. And if they drink extra fluids, their kidneys don't work well enough to get that filtered out and get it out of their body. So they swell up and then overload on it, and they can actually die. And we have to watch these people because they're so thirsty. And like we used to have this one guy, he had dementia really bad though, but he literally, like, we had to seal off his toilet. He would go in there in the toilet because he was drinking out of the sink, because we kept noticing his body was swelling and swelling and swelling and swelling even though he was on restrictions. But so they had to take off in the little bathroom in his room, they took off the spigot so that he couldn't get water out of the sink. We didn't think about the toilet till he got caught doing that too. Then we had to close off the toilet too. So, I mean, it's sad because, like I said, he had enough dementia that he wasn't thinking, hey, I'm drinking out of the toilet. But, yeah, you have to really watch that. So, again, intake and output is something you guys will do on occasion to make sure that you are writing down with every meal how much they have drank. And then a lot of times you will have them we have them pee in either like a hat, what we call a hat, something we put onto the toilet that catches it, and there's measurements on it, so as soon as you look at it, you can see, oh, well, that was 500 milliliters of urine, okay? or if they have a catheter, every time you input that catheter, you measure that, okay? But input and intake and output is something that you guys will need to be, will need to know how to do. Fluid requirements, basically, an adult needs about 1,500 milliliters, and that's per day. If you add 2 to 2,500 per day, that's needed for normal fluid balance. So 1,500 is our minimum. 2 to 2,500 would be normal. But again, we have to watch elderly people because they are at risk for dehydration and they are at risk for edema, which is swelling. Okay. Now, if they have special fluid orders, so it might say that we need to encourage fluids. Okay. When would we maybe use something like that? Can you think of any kind of a infection or something where you're always told drink lots of fluid?
IVF.
UTI, because UTI, urinary tract infection. I'm sorry, urinary tract infection is something that elderly people get a lot. Some of it is due to they don't drink enough, and some of it is due to it's mostly women because of the anatomy and incontinence. But when that happens, we are really trying to encourage fluids to really flush out all those germs out of the bladder. So restricted fluids, again, we talked about kidney problems or swelling, edema, things like that. Nothing by mouth. There are people who have nothing by mouth. They may have a feeding tube. Maybe they can't swallow. They have such bad dysphagia that they can't swallow. They may have a feeding tube. Or maybe they're fixing to have a procedure the next day, a test, or something that if they're NPO, that means nothing by mouth. And then we have thickened liquids for the ones who have dysphagia and can't swallow a normal thin liquid without it getting into their lungs. Now, I know, again, we talk about, you guys need to be familiar with that. We use that a lot to figure out if the kidneys are working right. Because if your kidneys are working right, how much you drink during the day and then how much you urinate during the day should be similar. Now, it might be 200-300 milliliters off, but it shouldn't be, I drank 3,000 milliliters of water and I had 500 milliliters of output all day long. There's something wrong there, okay? So again, we use it to evaluate kidney function and to plan their medical treatment. Again, we keep it if they have special fluid orders. And again, you're going to report everything they drink. But one thing that you don't think about is what is also considered a fluid is anything that at room temperature melts and turns into a liquid. So what would be a food that would be liquid at room temperature? Ice cream, Jello. Jello is considered fluids, and we still think about soups and stuff too. But some of the more things we don't think about sometimes are like Jello, because every time we see Jello, it's formed into a food and we eat it with a spoon. But actually, for people who we have to encourage fluids with, we try to give them a lot of stuff like that, extra ice cream, extra Jello, so that they're getting the fluids without really realizing they're getting more fluids. Okay. So again. If they have an IV, the nurse will be responsible for recording how much IV fluids they've gotten, because that counts too. Even though they didn't drink it, they're still getting fluids through an IV. And then, of course, output. That includes urine, vomit, diarrhea, wound drainage. So the INO record is kept at the bedside, and again, you total the amounts at the end of the shift. Okay, that'll be part of your end of the shift report. Now, in order to meet food and fluid needs, we need to realize what can affect people's appetite and ability to eat. So that's going to be like weakness, confusion, unpleasant odors. If they're stuck in their room, they just had a big fat bowel movement, and you come about 2 minutes later and serve them food, they may not want to eat because that's disgusting, right? It still stinks in there. I mean, they pooped. It stinks. That's how it is. Maybe they're in an uncomfortable position. Maybe, we always talk about brushing their teeth and oral hygiene because that does actually encourage people to eat. It makes your salivary glands start working to make your mouth wetter, and that in turn actually makes you more hungry. Again, if they need to pee or use the bathroom, they're going to hurry up and just eat real quick and get out of the way because they want to go to the bathroom. Okay, so we need to make sure we take care of all their needs before they eat. And again, if they're hurting, if you're hurting, that's all you can concentrate on. You don't really feel like eating. Now, dining programs are for people who are more alert and oriented, and those who like to eat in their rooms. Maybe it's for someone who is confused and noisy at meal times and kind of interrupts everybody else and causes everybody else not to eat. Or maybe they're incontinent or have odor problems or just too weak to leave their rooms. Again, if at all possible, we want them in the dining room. But there are sometimes cases where it's just best if they eat in their room, and there's going to be certain people who do. Now, these are some different dining styles and programs that they have in long-term care. You have social dining where everybody's in there. You have family dining, which is more localized into smaller areas. Low stimulation dining, restaurant style menus, open dining. Those are just some different things that people may choose to do in their long-term care units. Now, as we prepare for the meal, again, we just said that if they have to use the bathroom, they might want to eat. So we're going to make sure to do that first. Because I can promise you, it's going to happen. If you don't, you're going to have half your trays passed, and you want them hot when you pass them out. And then halfway through, you get to that resident, put the tray on there. I'm going to use the bathroom. Really? Why didn't you tell me that like 10 minutes ago when I could have done it, right? It always happens. So just try to make sure you have, just help them go to the bathroom first, any kind of oral hygiene, make sure their dentures are in. If they need eyeglasses, hearing aids, stuff like that, make sure they're in. Because it's very embarrassing for older people to go and sit in a dining room and their neighbor keeps talking to them and they can't hear them. It embarrasses the crap out of them. And I used to have a resident who would never go to the dining room for that reason. She had such poor hearing. She said it's embarrassing. People sit there and talk to me. I don't know what they're saying. And it's every day. And it embarrasses the crap out of me. I don't want to go down there. Okay? So just make sure they have what they need on. Make sure they're clean and dry if they're incontinent. Put them in a good upright, comfortable position. And then again, help them with hand washing. That's a big thing people forget sometimes. Especially if they're in their own room. You just go and serve a plate. You haven't made sure they even wash their hands before they eat. And it's disgusting when you look at the nails sometimes. Okay, you need to make sure they wash their hands. Now, again, OBRA requires the food has to be at the desired temperature when they receive it. So if you give it to them, they say it's too cold, give them a new plate, okay? Or warm it up or do something, okay? But that is their right. So again, you serve the meal tray after you have prepared your resident with everything that they need. And you're going to do it in the order assigned by the health team. If food is not served within 15 minutes, you need to recheck that temperature in case it needs to be heated up or anything like that. And if it's not correct, get a new one. Now, when you're feeding the person, make sure you give them a personal choice. Well, what would you like to eat first? Okay? Would you like a drink now? If at all possible, give them some sort of choice about how they're eating. And again, offer fluids during the meals. Okay? Sometimes we're trying to get done so quick that we forget to give them their fluids. Okay? Again, use teaspoons to feed the person. But understand that when you're feeding someone, this can be a very humiliating experience for someone to have to feed you. These are adults who have lost the ability to feed themselves. If you can imagine, that they're gonna have dignity issues, okay? So they may be depressed, they may be embarrassed, and they may even refuse to eat because they're so embarrassed, they just wanna get out of the situation now. They just wanna get out of the situation. So again, promote their independence, let them do what they can. If they need a modified spoon or a modified cup to be able to drink it themselves, let them do it. Because sometimes we get in such a hurry because all we're thinking about is, I gotta hurry up and do this, I gotta get this round, I gotta get these people fixed, I've got so-and-so baths, so many baths to get, and you get so caught up in what I gotta do that sometimes we forget, you know what, the resident is a person. We need to do the best we can for them, okay? Now, if you have a patient who cannot see, make sure you describe what's on their plate. Tell them where it's at on their plate. And make sure when you're telling them, we use just like the numbers on a clock, you know, if they have a divided plate, okay, so we say this would be like a 12 o'clock position, okay, your turkey is on, you know, on your plate, the 12 o'clock position. This would be like maybe a, I don't know, this is somewhere between 3 and a 4 o'clock position, and maybe this is the 8 o'clock position. Okay, that's how you describe what's on someone's plate, is like what number it would be on a clock. Okay, and that's how you describe it for a person who cannot see. Okay. Now, and again, always allow privacy and time for people who pray before their meals. That is their right to practice their religious beliefs. So make sure we don't try to rush them up and don't give them time to pray before the meal, okay? Now, again, we talked about meals are supposed to be a social event. So this is time to have conversations, especially if you're feeding a resident, or, you know, make it a social thing. It makes them feel good to have someone talking to them. But understand that if they have dementia, that you're going to have some problems, because sometimes they might get very distracted. Maybe they can't sit long enough to eat the whole meal, forget how to use their utensils, and they may even be resistant to your help. I don't need help, because they don't remember, they don't know what's wrong with them. And again, sometimes they may throw or spit food. That's just a reality. Now, between meals, we served a lot of snacks, as y'all have already found that out. And again, we should try to serve them as soon as they get to the nursing unit, because a lot of them get things like ice cream that you don't want melted by the time you give it to them, even though sometimes life happens. But, you know, just again, follow the same procedures as you would with any meal. Try to serve it at the temperature it's supposed to be, help them as needed. Again, make sure every shift, or if their pitcher is empty, that we pay attention and refill their water pitchers. And again, you're always going to write down what they ate, because that helps the dietary people keep up with how many calories that your resident is eating. Now, food poisoning, or what we call foodborne illnesses, is caused by different pathogens in your food or fluids, okay? So if you ever see any signs and symptoms of what could be food poisoning, you would want to report that. Now, again, food is never going to be sterile, so you can't get all the germs off of it. And again, most of the time, there are foods that have these germs, these pathogens on them when you get it. So if you cook it with something else or serve it on the same plate, it can actually contaminate other things as well. So again, a lot of times we worry about, especially in restaurants, a lot of times it's whoever prepares the food, they don't wash their hands like they should. That's usually one of the number one things that happens in restaurants and different places when you get food poisoning. It's usually sometimes not even the food, it's whoever didn't wash their hands, and usually it's a dude, because they're terrible about washing hands. But, you know, they don't wash their hands after they use the bathroom and things like that, because they don't think they touched anything, okay? And all the while urine, microscopic urine is all over them. So, Just the danger zone. We talk about the range of temperature that that these pathogens grow and multiplies between 40 and 140. So that's why a lot of foods, like certain foods that are more likely to get make you sick, like chicken, we do it well done, and that's well over the 140-degree temperature to make sure that we kill off any pathogens that might be there. Now, keep food safe. The USDA recommends 4 tips. First of all, you're going to clean, wash your hands, any utensils you use, countertops, you have to clean them off all the time. And again, avoid cross-contamination. Don't let raw meat touch your other food, okay? When you cook something, make sure you use a food thermometer to check the internal temperature to make sure that that food has been cooked to the proper temperature so that it will kill off any pathogens. Now, you'll notice on a lot of menus these days, because a lot of people like rare steaks. They just do. And obviously, a rare steak is not going to be a temperature that will kill off pathogens. So there's always usually a little disclaimer on the menu. It'll say like raw and undercooked meats can cause foodborne illnesses or something like that. Because someone's going to sue them because they ate a raw steak and got sick, and then they want to sue the restaurant as if it's their fault that these people chose to eat undercooked food. And, you know, so now they have to put these little disclaimers down there that if you eat raw or undercooked food that you could get sick. Now, once you get done cooking something, you need to either put it in the refrigerator or put it in the freezer within 2 hours, okay? Because if the air is 90 degrees or above, you just have 1 hour, okay? Now, quality of life, again, nutrition, fluid balance are very important things for our residents. We want to give them their own choice about what they eat as much as possible, and make sure that if you have someone with dementia, make sure that you work with them to try to meet their nutritional needs. And again, let the families come and bring food. Sometimes, sometimes they get tired of eating the same thing, and let the family come and bring a Big Mac every once in a while. Let them have something different.